Skin laser resurfacing is where we use a laser to target something in the skin. So it may be pigment in the skin, redness in the skin, it may be exfoliating and sloughing off that superficial layer of skin. There are several different types of lasers. We do have a laser that can go much deeper. We also have lasers that are more superficial. Also, the surface area is what matters. There is a laser that we have that's called the Halo. It's a partially ablative, non-ablative laser resurfacing, and what makes it really unique is most lasers and the old CO2 lasers, most erbium lasers, it's like mowing the lawn where you're totally taking off that top layer of the grass. With the Halo, what we're doing is we're aerating the lawn. So we're making small little microchannels and small little holes in the lawn or your face. And so it's able to, instead of completely destroying the top layer of tissue and ablating the epidermis, we're able to make those small little microchannels so the skin is able to heal from the bottom up, and you're able to get a deep laser treatment with the downtime of a very light treatment. We always recommend that you go to a physician-owned and operated medical spa. For some of the laser treatments in terms of pain, we will often numb up topically, usually for an hour or more. For some patients, if they require it, we can also do an injection. We could do a nerve block, or we could also do an injection where we numb up some of the main areas of the face with an injectable lidocaine. Because we are a physician-owned and operated med spa, we're able to do some of those deeper numbing services. Also, in terms of maybe going too deep or having an adverse event, that's something that we would discuss. We're also selecting the patients appropriately. We ask a lot of questions. So some of the questions we ask may be about ethnicity. Someone may have a very light skin type, but they may have some deeper melanin undertones, which definitely would affect our treatment. And maybe we would choose another treatment. Laser resurfacing may not be safe for the patient depending on their ethnicity. Most of our patients, their biggest concern may be crow's feet, so fine lines around the eyes, which we can only do so much with neurotoxins and fillers. So that's a very common complaint. Large pores, lasers are great at treating large pores. The specific lasers that we have are from Cyton. They're erbium lasers, and their target is water in the skin. Technically, we are tightening the skin, but we're also stimulating collagen and elastin at the deeper levels, and the skin's healing from the bottom up. And you want to dehydrate the skin, because let's say you have like a ton of fluid on the skin and then you do a laser, it's not going to have a target because there's too much water on the skin. So if it's done wrong, patient could have permanent scarring, they could have hypo or hyperpigmentation. And sometimes that's very difficult to treat. That could be something that's permanent. This is why we would recommend that you go to a physician-owned and operated medical spa, have an appropriate consultation, and determine prior to the treatment that you're an appropriate candidate.